Since 2011, CVSAN has worked with Castro Valley schools to reduce garbage by auditing campus waste. The collaborative waste audit process identifies the type of material going into the garbage that could have been recycled or composted.
So I've heard that there's a lot of concern about a potential operator coming in Castro Valley on Center Street. And I just want to point out once again and reiterate this very strongly. It's premature. There's no permit to operate an additional dispensary in Alameda County, unincorporated Alameda County, and there's clearly no authority to issue a permit to operate in Castro Valley. There is none. I think when we enact a new ordinance that complies with the state, then there'll be a two-pronged process for an operator to determine whether or not he or she can operate in Castro Valley. First, they'll have to go through an RFP process, which the public can weigh in on. Doesn't guarantee that they'll get the opportunity to have a permit, but if they do, then they can select a site to operate, and that would go through a CUP process. Once again, another public process. And if that CUP process, if somebody considers Castro Valley, let's say Center Street, that would have to go through the MAC. The MAC could weigh in and advise the Board of Supervisors on whether or not to support a CUP there or not to support it. And if we do support it, what conditions would apply. And that would go to the either the Planning Commission or to the Board of Zoning Adjusters, and then the recommendation would come ultimately to the Board of Supervisors. So any angst people have about this at the moment is, I think, just premature, and it's really just background noise at the moment. If Castro Valley Matters is raising stuff and there's discussions on the blog, those discussions are good, but clearly, once again, this is still just all background noise until there's something concrete that's in place. People can weigh in on the process that we're presently following to have our ordinance come into compliance with MRSA. That is definitely appropriate, but any potential locations or any potential operators, all that's just premature. I think the focus needs to be on what is the county's new ordinance going to look like, and I think that's where the emphasis needs to be placed. And then after that, we can get into the details of who's going to be the operator and get into the details of where this operator might be allowed to operate. And I think I kind of tried to point this out, that the county has an obligation. Right now, in Alameda County, the city of Oakland allows for dispensaries, retail operations. San Leandro is allowing for it, just one, and then Berkeley will allow for it as well. So there's a dearth of operations that are allowing for the retail access of medical cannabis. And I think it's important that the county allow for convenient, regulated access to medical cannabis here in Alameda County. We have the obligation. Cities might decide they don't want to do this, but cities aren't obligated to do this. Cities aren't responsible for this. This is not part of their governmental responsibility or mission. Cities have other responsibilities. So if cities decide not to allow for retail cannabis operations, that's fine for a city to do that. I don't think it's fine for the county, because we need to make sure people can get access to this medicine if they do need it.
So realistically, if the two parts of what the county's putting forward and considering, what would be the timeline for a possibility of more dispensaries opening?
I would think once the county enacts its ordinance, let's say if we enact the ordinance in December, towards the latter part of this year, December of 2016, then we do an RFP process. Generally, an RFP process can take anywhere from 3 to 18 months. It could. I don't think it's going to take 18 months. So let's say 6 to 12 months, maybe. So let's say the low side would be 6 months for an RFP process to get resolved. So then we're talking possibly mid-2017. Then the selected applicants who have now gotten permission to have a medical cannabis permit, after that they would then submit the locations to get a CUP, and that process could take anywhere from 6 to 18 months. So we could theoretically, on the short side, be looking at probably not until 2018 would we see a new operator or additional operators. But on the very long side of that, we could be looking between 2018 and let's say 20, maybe even first part of 2020, because it could take that length of time depending on how much evaluation the county has to go through with the RFP process and with the CUP process. And it doesn't mean, once again, that it would end that there would be an operator at the end of the day. That operator might not be selected, and it would also depend on how many permits we're going to open up. If, like I said, if we open it up to, we've got 2 now, we can allow 3, and if, well, let's say our ordinance changes and we're going to allow upwards of 6, so that would be 4 that would be going through the process, and those 4 could be at different stages in that process over the next 3 years. Yeah.
And at every step of the way, there is public comment and public meetings for.
Yeah, every step of the way, there's public comment. The public can weigh in at Board of Supervisors meetings, at committee meetings, at MAC meetings, at unincorporated services meetings. Yeah, there'll be a lot of opportunity for public input. It doesn't mean that we will not dismiss public input, but I don't want people to think that anything's guaranteed either way. Yeah. The only thing I think I'm hoping for is that we allow for more dispensaries so that they can dispense this medicine to needy patients. And so now what's happening is the state last year passed a new ordinance or new law. It's a statewide law. It's called the Medical Marijuana Regulatory Safety Act. And MRSA, as it is kind of commonly called, now opens up the entire medical marijuana industry statewide. And they're no longer calling it marijuana, they're calling it medical cannabis. And it establishes various types of operations throughout the state. You can be a retail operator that just sells medical cannabis. You can be, you can test it, you can cultivate it, you can manufacture it, you can deliver it, you can transport it. There are any number of types of operations that can be legitimately allowed throughout the state under the new state law. So once the state enacted their law, I wanted to get our local dispensary ordinance to be in conformance with what the state now allows so that our law mirrors the state guidelines and regulatory scheme. And that's what the county's been working on really since the last part of last year, 2015, into 2016. This is now July. So we've been working on this for a good 6 or 7 months, trying to bring our ordinance into conformance with the state regulatory act at this point in time. And what we've been looking at is getting our dispensaries to become operational under the state guidelines, looking at delivery, looking at a possible pilot for cultivation, and looking at how we would handle edibles, because under state law, folks who consume medical cannabis, it's not considered a drug, nor is it considered a food product. So we've been looking at how we would allow for people who want to consume it in an appropriate manner and have it produced in an appropriate manner that environmental health feels comfortable with. So we've been looking at all of this. And then after this effort, we'll be looking at how it could be permitted in Alameda County to do testing, to do manufacturing, to do cultivation, and we would establish our guidelines. And ultimately, our guidelines have to conform with what the state will allow. And the state hasn't come out with its standards for operations just yet, but we can go ahead and establish our own best practices around these guidelines. And that's what we're attempting to do, both with the initial retail effort, the pilot effort around cultivation, the delivery, and then ultimately we'll move into cultivation on a more broader mechanism. Tracking would be part of this. How you're tracking the product, how you looking at weights and measures. Does it really prescribe to what is actually being said? How it's manufactured, Are they using organics? Establishing regulations associated with manufacturing, looking at the whole testing aspect. Well, all of this will be coming into fruition. And because the state law, MRSA, the Medical Marijuana Regulatory Safety Act, allows for all these various types, we're going to be exploring all of this, I think, in Alameda County. So the schedule for the county's ordinance that we will bring forth for the Board of Supervisors to consider. We've been looking at this through our Transportation Planning Committee since the latter part of last year. We've taken it to the MAC. We've also taken it to Incorporated Services. At this point in time, the county staff feel we need to have an environmental study done to determine whether or not we need to have some form of environmental review around the ordinance that we're looking to enact. So we're now going to go through an environmental study phase between now and let's say September, and then that will determine what type of environmental review is necessary. The environmental review, along with a proposed ordinance, would come to the public, the MAC, the Unincorporated Services, the San Lorenzo Homes Association, anyone else, any other appropriate community group for review in September. Then in October, the board would once again review this through our committee structure, Unincorporated Services, and probably Transportation and Planning. Then the final ordinance would come to the board for a first reading, the first part of November, and then the second reading towards the latter part of November, the first part of December, and the ordinance would become effective upon the second reading. And this ordinance would look at the retail operation, which we consider dispensaries, look at the delivery service, that's how patients get their medical cannabis, and it would also look at a pilot program for cultivation, but that pilot program would be restricted to our 2 operators who have been determined to be in good standing by the county and have been operating with the county for more than a decade. We would try to implement a pilot program around cultivation with them. That's what we'll be looking at around this first phase of implementation of our ordinance to conform with the state's Medical Marijuana Regulatory and Safety Act. Then we'll go to the second phase, which is much more extensive around all of the various types that can be issued in this new industry that the state is now allowing for under medical cannabis. And then once again, if something happens and the initiative passes in November for adult use, then that will become another track that we'll be looking at as it relates to the whole effort around cannabis at that point. But at this point, we're not even looking at adult use. We're just looking at medical cannabis.
Since 2011, CVSAN has worked with Castro Valley schools to reduce garbage by auditing campus waste. The collaborative waste audit process identifies the type of material going into the garbage that could have been recycled or composted.